Provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Dr. Tom Roselle Live, Ageless Health, and we have a great program for you today. Ongoing process of talking about why your brain doesn't work and how to get it back. More than importantly, is there something that can be done about it? We've touched upon the subject a little bit, but we're going to get into the weeds a little deeper today and want you to know that, we have a program that's coming up. If you go to Dr. Tom Roselle Live, you'll check it out. And you'll find out that we will be at the Roselle Center on December 17th at 6 p.m. And we're going to be doing a program on early onset of dementia leading to Alzheimer's. So if you got worries, like you forget where you left your keys, well, this is a program that'll give you the opportunity to figure out what to do about it. But more importantly, we want to give you tools. We want to give you opportunities. We want to give you things that can make a difference. I have the privilege today of having a brilliant doctor who specializes in a lot of different types of what's going on in the dark, meaning, Alzheimer's and dementia and early onset, and I forgot where I'm supposed to be and that type of thing. And we're going to look at it from basic understandings of what really takes place when you start to lose your mind. And having said that, a very dear friend of mine, a colleague, someone who I work with on an ongoing basis, on a day-to-day basis, actually, Dr. Scott Lamp. And Scott, welcome to the program. You haven't done this one with me before, but we're going to get into a subject that everybody's extraordinarily fearful of. And there's one thing that we don't want to lose as we get older is our brain. As a matter of fact, it's early onset, meaning that it can happen at any age. So this is a sweet spot for you. It's something that you have, spent a lot of time looking at for a lot of reasons, personal and otherwise, not personally you, but let's get into it just a little bit, starting with some basics. Scott, how many people in the good old USA, if you will, really are predisposed or can truly be fearful that they're going to lose their cognitive functioning as they begin to get older?
80%, possibly climbing up. I mean, this is one of those classic things that, what do I do to myself, or what are my exposures? It's what's the terrain or the environment that we're in that we keep on polluting. And the more we do that, genetics play a little part on the part there too. The more you have people on the dementia side or Alzheimer's side in your family, the higher the percentages go. But I think we're all possibly having some of that. We all have, sometimes we seem to have those moments, but those are going to be something that basically really environmental factors play a huge part with. And I think the exposures are what we do. What it really comes down to is how do we do energy? How do we do circulation? Those play a major part in everything we're talking about.
Scott, let me ask you a question. That's, and a lot of people will say, well, my father had it and my great-grandfather had it. And we begin to be fearful of genetic predispositions. But if you had to list three things that were, 1, 2, and 3, in whatever order you want to put them into, that we had to be aware of that happened to us, things that are maybe predisposing years later, we didn't think about it before, that would cause us to be susceptible to cognitive decline and the onset of what we call dementia, whether it's old age dementia, whether it's PTSD, whether it's, leading to the tau proteins and amyloid patterns and so forth going into Alzheimer's. What does that look like? What people really have to be aware of? That's
good history is like, what kind of physical traumas have you had especially directly to your head? And even when we think about something, even like a motor vehicle accident, it's not necessarily like, I didn't struck my head, but I whipped my head back and forth. Well, you're whipping your head back and forth. You still have this brain that's in this kind of like container of our skull that bounces around a little bit. And when you have a brain that's the consistency of tofu, and you got a really tough membrane there's some stretching and pulling and tearing that could possibly happen that could have effects on us years later. So the structural aspect of that is going to be one of those things. A real big one is going to be sugar in its many different forms. And we think about sugar as like, well, I have a really good diet, but your sugar also plays a part when you have a stress situation. In the stressful situation, you put out cortisol, put sugar out, and you can induce things because of what your stressful mechanism or what sugar does. So insulin resistance is a big part. And then I think anything that happens to do with circulation, and you probably put that into maybe the how well the mitochondria in your body, how's the energy production cycle is going for your body? Is that being interrupted by a lot of things that we eat, that we do? Our habits are associated with that. So do we have good circulation? How we're controlling blood sugars and those kind of things? What kind of head traumas we've had in the past? And it's accumulation of effects that could cause these problems.
Scott, let's talk about the head trauma pattern, because so many of us, from the time we're young, we get into sports, from soccer and headbutting the ball, playing football, wrestling, lacrosse, and the checks against the basketball court. So we get these blows very much like micro traumas ongoing. Some of them are more than micro traumas; they're quite significant. Mm-hmm. And it's almost like, and probably for our listeners, what I can relate it to is a boxer who's been in the ring and is not really good. He's been taking a lot of blows. Even the ones that are good take a lot of blows to the head. And pretty soon they get that punch drunk, if you will, persona, where they've really lost their capacity to do with it. Even the great Muhammad Ali, he went into a Parkinson's pattern towards. So how does that happen? What is the effect of that type of impact? What does it do to the brain?
Well, I think a lot of different factors when you're looking at, where do we start causing scarring that happens in the brain? And when we talk about all these things, you just mentioned like Parkinson's, and we also have dementia, and we have some of these things, neurological diseases, ALS, MS, things like that. We start affecting these kind of like branches, these neurons. They have these branches that go out, and they kind of liken it like a Christmas tree lights. The Christmas tree lights themselves start to get tangled in a mess. And when you have either a chemical induced problem or a physical induced problem, eventually when you start looking at some scans of the brain, it becomes a tangled mess. And the interactions and the connectivity is not quite there, but it all looks the same when it comes to the end. So you have inflammation, you have dementia, you have physical aspects, CTE, some of the things that happen with the football players. At the end, it all looks like a tangled mess, and the communication line doesn't connect well, and the circuitry levels are not connecting well. And so you got problems there. We have something like even some of our people going into the service that have problems with some concussion problems. And they had a very good paper that came out. It was actually by the military. They were thinking, how do we get our people to stay in the field? Versus, we have our veterans, but our main concern is the people that are in the field. And dietary aspects where you need to have certain fats and things like that fats are like slippery and things. And you think of the brain being slippery and movable and sliding. But if we eat things that don't help us do that, we don't have the good quality oils we have, and the brain now doesn't have that slippery ability to move around in the skull. It can pull and torque and rip and tear. Then we have these kind of these problems. Add that with physical structural pushes on that. How good is our slipperiness on our cells to maintain a cushion versus some of those that are stiff because of what our dietary habits? There's so many things that overlap these that we can do things to kind of stop it, or not necessarily, stopping Alzheimer's. We can definitely improve ourselves before we get there. The other big thing is there's a point to where there's almost like a nod. When you get all the way there, that's where we have problems. The best time to take care of it is stopping it now.
So, on that note specifically, so the American diet of a lot of people going to low-fat diet plans are one of the worst things that you can do to protect your nervous system.
Right. Absolutely. I think the thing is like they were doing some of the medications. They're saying, we got these. There's no medication out there right now that actually stops Alzheimer's. You could maybe stop some of the decline. They say about 27%. But the other side of it, if you were taking a good extra virgin olive oil, has a better result than actually taking some of these medications that slow it down. There's nothing cures it. We got to get the things before it becomes major damage. And that's what we need to look at. or habits we can do now in our 30s and 40s and 50s before the 60s and 70s and 80s become terrible.
Scott, which brings me into a question. Some of the original work that was finger pointing towards different types of fats was going back a couple of decades ago. And I think I mentioned on one of the programs, there was a nurse whose husband had gone into very severe end-stage Alzheimer's, and they told her there's nothing to do. But she had done some research on MCTs, medium-chain triglycerides, and the heavy usage that she went to that has a tremendous amount of active MCT was coconut oil.
Right.
And so she got this guy up to apparently taking somewhere in the neighborhood of 9-10 tablespoons, I think even more than that, of coconut oil a day, almost giving him a tablespoon every hour, and fully reversed it according to the studies. How did that happen? I mean, what were the basic underlying pieces that caused that to reverse itself?
Well, I think, Tom, you probably know a little bit more on this than I do in that aspect, but I think that's, again, one of those things that are anti-inflammatory. We also have some aspects of like how much on fats and ketones play the energetic level coming into the brain. You've got to be able to feed it well. And as we know, sugar versus like a ketone is more of a cleaner fuel to the brain. It actually helps it work better and go better versus more of a sugar base. It seems to be not as clean as a fuel. So if that's what the point you're looking at, that's what I think we'd be more looking at MCT oils and olive oils and things of that nature. But not all oils are good either. So you got the trans fats that are out there that are pro-inflammatory. And again, inflammation slows everything else, doesn't help make connections, breaks things down. So we want to make sure we're staying away from things like linoleic acid and stuff of that nature.
It's important that people understand that there are good fats and there are bad fats, and the bad fats that are out there, and particularly any of the seed oils, are not good things. They go rancid very quickly. They cause an inflammatory cascade acid when we talk about inflammation, and it causes the neurological tissue to break down because you have that wrapper, if you will, around the brain, but also around the long nerves from the spine and the spinal cord itself. It's composed of what we lovingly call a myelin sheath, a protective element. And you need things that will protect that. Choline, as we know, is one of those elements, but it's an extraction often of the good oils, if you will, that help protect that situation.
I think the thing is knowing what your ratios. I mean, the omega-6s is what you're talking about. A lot of the omega-6s are pro-inflammatory. There are some good ones, but the majority of them are bad on the seed oils we were talking about. And the ratios between that and omega-3s is really important. I guess anywhere from 5 to 1 to 1 to 1 is where you want to go to. We've talked many times, in the past in regards to these blue areas or the blue zones and things like that, where they're looking at lysing the red blood cell and saying, okay, what kind of ratio of omega-6s to 3s do you have? And they seem to be in countries where people live the longest and they have the less need for long-term medical care, so to speak. And we're looking at, Sardinia, Italy. We're looking at places in Greece. We're looking at in Japan and Costa Rica and the Loma Linda that's out in California, where there's also certain habits these people have, but they can also look at, and we can look at something called brain span. We have that capacity here in the office, is looking what's that ratio and how to maintain that ratio. A lot of these places you look at them are also on the water. Fish plays a big part because they're on the coastal aspects. They're eating fish, plant-based diets that seem to be cause of that. Also, very low stress, family-related, very strong family structures. There's a lot of those things that overlap in each one of these things that say, wait a minute, we're making these things, and these people are living to the 90s, or when they pass away, they're not suffering. I think you talk about being in Italy, where you have somebody, grandma, it's like, oh, well, she goes back, she wants to lay down, and then she passes away quietly, not like, okay, how many different machines can it be on? How many different forms of medication can I be doing? And how big is my medicine cabinet?
Well, as you know, I'm first generation from Sicily. And when I go back to the old country and visit my father's village, the only oils that they use are olive oil. And the fish that they get, and here's the piece that I wanted to interject, the folks that are on the coast that are eating fish that have these higher levels of cognitive solidness, if you will, they're eating wild caught fish, not farm raised fish. The farm raised fish can be as bad as polluting yourself with a soda. And unfortunately, people don't get it. They say, well, I'm eating fish. Well, there's wild caught salmon from the Norwegian area, and there's farm raised salmon from the Atlantic Ocean. I can tell you right now, you want to stay away from the stuff that's farm raised. So, but you see these people, going to that story. I had a great aunt, my father's aunt, that lived till she was 100 years old. And every day, interesting, she had a habit that she would take at least a couple tablespoons of olive oil and fresh pressed olive oil from their farming areas there. And anyway, she lived to be 100, and she cooked every day for the family. And you could see her, she was getting tired or more tired. That's more tired, if you will. And this one night, the family's around the table, and she got up. She says, I'm tired. And she kissed everybody at the table. She went over and lay down on the sofa that was in this great room, that they were all gathering in. She closed her eyes, and that was the end of it. And how many of us in this world, in this country, go through that beautiful transition? Very few, because of what we've been talking about right now. It's unfortunate, but the brain span test that you mentioned that we do in the office, and it's really critical because it's simple. It's combined with a computer platform of testing responses and so forth. It's a finger prick blood test, and it measures the fatty acid levels and the things that should and shouldn't be there. And it gives the patient a great perspective of where they are, but more importantly, what they can do specifically to begin on their own to reverse it. And then the other things that we do. Scott, I want to talk just a little bit about, we've got a few minutes left, about how you look at genetic mapping as it goes to this, even myelin patterns that are predisposed because of that. Are there tests that can be done? Are there things that you can do to really show that perspective and say, okay, here's what we have to do. This is what we have to do neurologically. This is what we have to do biochemically.
Well, I think when you look at genetics, APOE4 is a genetic marker that can be found. You can do that in basically any type of genetic testing and find what that is. The question is did I get one both from mom and dad? When you have, they have something that calls something as heterozygous or homozygous. That term means basically homozygous means I got one from both parents. Heterozygous, I got one from one and not from the other one. The more of that is, it's a little bit more severe in the genetic aspect. But when we talk about relationships of genetics, we also got to take a look at terrain. And I think, how much is this really associated with the genetic part, but how much is terrain? I think terrain plays so much more. You hear it back and forth about, okay, well, if I had a heterozygous, I have a 30% chance of maybe coming down with something. Well, how many of those factors are being hit, and what are your risk factors? How many of those APOE4s are showing up when you're getting the genetic mapping done? Or if I had a heterozygous, they say you might have a 70%, or a homozygous, you might have a 70% chance of happening. But I think really looking at what is your terrain that you're dealing with and what you're living in with the lifestyle, you can really do some differences and change those things. I think we just heard, was it Chris Hemsworth, the guy who played Thor on these Marvel movies and stuff. He was considering backing away from acting aspect because he has both of those things happening with him. But also, do you live well? Do you eat well? Do you do those things? And you can have those things express. I thought there was an interesting thing. I don't know if you heard about the story that's in Finland, where they have a lot of times that we're a world society of moving all over the place. So we're mixing our genes with everybody. But in Finland, they were able to go back several generations. I'm trying to recall what the neurological problem was, but it was interesting when their environment had when they had like a drought, and the next generation had this neurological disease that would show.
Scott, I'm going to hold you over just a second. I'm really sorry. I've got to call it quits for this segment. But if you want to get a hold of Dr. Lamp, get a hold of him through us at drtomroselle.com. We'll be right back with another segment in a very short period of time. Don't go away. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey everybody, welcome back to Dr. Tom Roselle Live. We have a great program for you today, and we're going to move it forward. My guest has been Dr. Scott Lamp. And, the first part of the program, we got into talking about some of the predisposing factors of dementia and cognitive dysfunction and so forth. And as I said, Dr. Scott is an expert in this area. He's one of our best in areas of methylation pathways and genetic mapping and so forth. But this is an area that's of tremendous concern for all of us. We talked a little bit about making sure that your ratios of essential fatty acids are optimized and that you don't eliminate fat from your diet because your body needs it to heal with. We're talking about the things that we have to be aware of, that you can do, that you need to be cognizant of. And having said that, Dr. Scott, welcome back. And thank you for taking the time today. I really appreciate it. And as we get into the program, I kind of cut you short in the last segment talking about a story that was going to kind of draw this back together. If you would, if you recap it, and let's move that forward, and we'll add some clarity, if you will, to what really needs to be known about this ugliness called losing our minds.
Well, I think what we're talking about is more or less the genetic expression that happens in societies. One is going to use Finland. they had some drought conditions, and they would find that the next generation, they had a group of information they can get. So a lot of people weren't moving. They could have pretty consistent gene pool. It was the point from Finland. But the thing is that if they had a drought, the next generation had a change and shift in their gene expression as it went through. So basically, those people would suffer some neurological diseases they would never see. But then when they had good crops and things of that nature, the next generation would come up and would be good. So we do have some aspects of genetics that play a part. But then it's actually absolutely critical about what we're doing and what we're doing now before waiting for something that's going to happen later. Especially if you have some decline in regards to, I can't remember something, names or some places, can't remember the place where I'm going to, can't multitask, those things start to change on you. 10 years from now, that could be something that's major. You can do something about that and take care of it right now. We just want to look at the terrain is extremely important versus genetics. We like to put so much on the genetic side. I'm just saying the terrain plays a major, major part of how we live, how we do circulation, how we do exercise, sleep, blah, blah, blah. Those are things that play such an important part to either recovering or make it easier to deal with this particular disease processes.
I'd like to invite our listeners on the stations that are paying attention to us today, that if you're in the Washington, D.C. area, we have a program coming up December 17th, 6 p.m. at the Roselle Center for Healing. It's in Fairfax, Virginia. Really easy to get to. It's a Washington metropolitan area. It's right off the National Capital Beltway on Route 50. And you get off the Beltway, it's about less than a quarter of a mile, and you're right there. We will get into Dr. Scott and I will be going back and forth on this topic. And we're going to give you tools. We're going to give you the capacity to really resolve and turn this around. So December the 17th, 6 p.m. It's a Wednesday evening. So we'd love to have you as our guest. And we'd love to show you what we do. But more importantly, give you the opportunity to make sure that you can prevent this thing that we're also fearful of. We don't want to go to that place where, when we get into our later years and we're sitting there and our brain just doesn't work. We can't remember what we did yesterday. You have to sit there for a while, remember what you had for breakfast this morning. That's not okay. And the bottom line is, it is preventable. Let's get into this a little bit more, Scott. The area of dementia is being addressed, if you will, in the medical community using things like Aricept and so forth. And it doesn't work. I mean, it's straight out. You go into the literature and it really doesn't do it. The literature basically says it may slow down the progression of it over a period of time.
That's it.
And that's all it does.
Right.
Now, just what can somebody do? We talked a little bit about lifestyle, and that's important. We talked about head trauma, that can predispose itself over a period of many years. We talked about making sure that we have fatty acids in our dietary patterns as well. But if we wanted to really focus on what can I do to really make sure that, setting aside all those things we talked about, that I give myself every opportunity that I leave this life just like I came in, sharp, able, attentive, able to multifunction, multifocus. What would that be if the patient was sitting in front of you, they were asking you those questions?
Well, I think the thing is you need good circulation and you need energy. So you get the very basic aspect is circulation and energy. The brain needs to be fed. And it's interesting when I have the history of my brother having a stroke. One of the things that's interesting is that we really got to get the brain needs stimulation, it needs oxygen, and needs nutrition, and all those things that play a part. If I don't sleep well, the brain, when you're sleeping, has a tendency to clean itself. And with that cleaning itself and the deep oxygenization, when you get into deep sleep, really helps with oxygen in the brain, and it cleans. If you don't sleep well, that's a major factor for making these things having more problems. With that saying, what's one of the best things for circulation? Exercise. You got to go out and exercise. You talk about walking 2 miles a day. Get out there and circulate. And then what happens is when you move your muscles, it's interesting how our arteries are placed in the muscles to help push blood flow through the rest of our bodies. You've got to move. And the more you stagnate, you become a cesspool. And if you're in a cesspool, you're going to invite other things, which is another problem because we have a lot of infections, COVID being one of them, that can actually come in and corrupt this system very, very strongly. I think one of the things that people don't realize how much your teeth play a part with your overall health for your brain and your heart. If you're not flossing, you're not doing some of those, you let bacteria and things get in the system, and those immune challenges and the things called cytokines. We talk about cytokines that happen with COVID, where you have this kind of like wave of inflammation that comes in. Instead of having the cytokine storm, this stuff is like a cytokine drizzle. It just constantly just dripping in and dripping in and dripping in if we don't do things to take care of it. That's a basic thing. Can I brush my teeth? Can I sleep? What's the stress mechanisms? Because, when you talk about where does sugar come, how to get sugar in your body? And people are like, well, I eat it and I drink it. You can stress it. And that goes into a big part of it.
That's right. People don't realize that.
And there was a symposium that was back, a couple of years back. It was a 20-hour symposium. All these experts came up. It all came back to the same things. Are you exercising? How much sugar that's in your food? What kind of, what are those elements in the food? Are you sleeping? Is the sleeping there? Do you have sleep apnea? What's your exercise component? How do you relax yourself? How do you do flexibility? How do you, those things? So circulatory things are extremely important. And that's another thing when we talk about those areas of blue zone areas. These people are walking, they're doing Tai Chi, they're yoga, they're doing other things to keep themselves moving. And then the brain needs stimulation. We'll talk about there's different like brain games to do for things to help you work with making things work a little bit better in the capacity of things you're thinking about. And I mean, we have a lot of these little tools we have. I have a really good survey we use, and it talks about, can you focus on what part of the brain might be a problem, or it's something that's showing up, or if I take this test, I might be observing like, wait a minute, can I work on things on my right side of my brain or my left side of the brain to make it work? The brain needs stimulation. And if it doesn't stimulate, and when you stimulate, it does send oxygen to it. It does send, the fluids that they're there. You need to kind of make that work. So stimulating brain is extremely important. So a lot of little things you can do.
You said something earlier, and it's something that was unknown to the medical community for a long time. And in our world that we deal with, especially that we have in our practice in applied kinesiology, we've been aware of it, but now suddenly mainstream has been picking up on it. The brain actually has a removal system of waste. You mentioned, that you got to keep it clean. So, right, it's called the lymphatic system.
Yeah. Mm-hmm.
And that lymphatic system for the brain, purges a lot of debris, a lot of garbage, and so forth. But if we overload that system, it gets stuck and it gets hard. I want to bring that into another piece of a lot of cognitive dysfunction, particularly Alzheimer's, has been known as a type 3 diabetes. Right. And you talked about not only the dietary and environmental impact, but you also said stress patterns, that will cause blood sugars to come up. Just for our listeners, we got a few minutes left in this segment. What happens? How does that type 3 diabetes really occur? The brain needs glucose. That's its primary energy source. But we're alluding to the fact that if it gets too much, it's a problem, and it can cause that glycation, if you will, that heavy incrustation, that stopping of communication from one cell of the body to the other. Shed some light on that, because most people are going to say, what are you talking about?
Circulatory. I mean, this is a circulatory pattern that when we happen with the glycation, sugar's sticky. And so if you have too much, it's like fuel in almost all of our cases. We look at nuclear fuel. Okay, nuclear, it's helpful, but if it gets overexposed or spills over, it's too much. It creates a problem. You need to contain it. We need to have the energy to run, but we don't have that. The problem is excess, and the excess causes problems. The other thing is also when you have any type of sugar in the system, you raise insulin levels as an insulin response. And then too much insulin in the body is also degrading to the system of the body. So when you're looking at things that get sticky, all of a sudden the arterial walls are plaqued up. It's very hard to get things to move fluid. You need circulatory systems to go. If you can't get the blood flow, you can't get the fuel there, that's a problem. You just got to get the stuff moving through. And that's the way where movement factors help, but it doesn't help when you're putting a whole bunch of other junk in the system. It doesn't help at all. You got to get circulatory and basic things, circulatory oxygen, get it there. And one of the things is going to, again, stimulate the brain. Get the brain to stimulate it. It's going to want that and try to pull it to itself and learn from that. On the other hand, are we doing things to just plaque stuff up? And our choices, like the types of sugar, we like high fructose corn syrup, is nasty. It does some nasty things to the liver, but it doesn't process things well. And what's interesting with fructose, especially, we have this thing called the Krebs cycle, where we want to make mitochondria or ATP. In the ATP and the mitochondria makes ATP. That is really our gas for our bodies to run. The sugar is something that has to be processed to get to that point. And if you don't do that well, that's another reason you're not getting things to work. So how does the ATP get functioning? And we eat things like fructose that blocks that passageway.
Stops it completely.
Yeah. And so now there is some fructose that comes from fruit, by the way. It's actually not that bad. It actually helps that system slightly, but not as bad as the high fructose refined crap that happens, and that really blocks that up.
No, the thing of it is about the fructose and sugar. It is a different moiety, if you will, a transport system into the body. But even that, at too high of a level, is going to cause exactly what we're talking about. And here's the other piece. I touched a little bit upon how stress patterns cause blood sugar levels to rise, but they also cause cholesterol levels and other types of fats to increase and rise, and they cause the bad ones to go up. Cholesterol is not a bad thing. And so having said that, there's two pieces that I want to talk about. One is that people who are on statins habitually, and their doctors want to lower that cholesterol down to nothing, the brain needs as a primary fuel, second to sugar, is cholesterol. Right. And if it doesn't have cholesterol, brain becomes cognitively dysfunctional. And so the drugs that we're taking, which, by the way, cholesterol has never, ever, lowering it by a statin, the statins have never, ever been shown to prevent a heart attack or anything of that nature. There's nothing in the literature. There's a lot of other inflammatory elements that cause calcium to come in and hardening the arteries and so forth. But when somebody is on a cholesterol medication, statin medication, it causes the mitochondria not to function, number one. So now you have your cognitive impairment coming from there. But also, in addition to that, it's causing the neurotransmission within the brain to fail. Mm-hmm. So now you've got the slowing effect, and it happens across the board in a lot of other things. But go ahead. What's your input on that, Scott?
Well, I think one of the things when you take a statin drug, there's like 23 steps out of the body, and the liver makes cholesterol. And the third step is making CoQ10. And CoQ10 is the mitochondria for the heart. I mean, what are we trying to do here? It's like, it seems like we're getting ourselves in our way when we're trying to do some of these things. And there's so much more to it. Also, when you talk about cholesterol, what's all your cellular linings of your body made out of? It's cholesterol. So do we want leaky cells?
Exactly right.
And I've always find it's interesting when you go, cardiologists like, oh, look, I got my cholesterol for the person below 100. And I'm like, what? It's supposed to be healthy. We want to see the other side of the factor. We always get painted on one side of the fence. What's the other side of the fence look like? You got to understand what both sides are. You drink too much water, you can drown, literally inside out. We had a guy at the Marine Corps marathon where he drank like 5 gallons of water before he ran. He dropped out. His electrolytes couldn't connect. He drowned from the inside out.
It diluted. There was nothing there to transport.
There's nothing there. He couldn't make a connection. So the same thing is we need to have cholesterol. I mean, you would say like probably around 150. You want to have at least about 150 in your blood values, so that it's good for your brain. It's good for the cholesterol situation in regards to around the cell lining, and that's why sometimes if you've ever taken a cholesterol medication and you might have like sciatica or problems, the myelin sheath now gets affected on the cells. Right. So now there's an irritation there, and all of a sudden it can give you back pain. or give you muscular irritation that happens with these type of things. So
Scott, we're coming up to a break, so I want to continue this discussion when we come back, and I want to give our listeners a couple indicators of what they can really do to be aware, to talk to the doctors about. But anyway, let's put a kind of a mark on that. We'll be right back after these important messages. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellcare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Welcome back, everybody. This is Ageless Health with yours truly, Dr. Tom Roselle. We've got a great program going today. Talking to, as far as I'm concerned, one of the brightest guys I've had the pleasure of working with over many, many years of my career, Dr. Scott Lamp. And we're talking about something that we're all very fearful of. We're talking about dementia, the loss of cognitive capacity to be present and leading to something ugly called Alzheimer's. And those of you in the Washington metropolitan area or can get to us, coming up very quickly on December 17th at 6 p.m. at the Roselle Center in Fairfax, Virginia, we're going to be doing a class. Starts at 6 p.m. It's a Wednesday evening. Dr. Scott and I will be going back and forth. And it's the who, what, where, and why, if you will, of early onset dementia, Alzheimer's, the things that you have to worry about. But we're going to be able to show you for yourself what really the problems are, how you can avoid them, things that you can do about them. And we do these programs ongoing. So to find out when we do something, and you're always invited, just go to drtomroselle.com and you'll see the lineup there. It's important that we give you as much data, and that's our whole mission, is to give you as much information as we possibly can. Scott, welcome back into the last segment of the program. Let's talk a little bit about what people really need to be aware of moving forward relative to changing perhaps some of the deadly things they're doing? We touched on a lot of information, and most of the stuff we could talk about all night long. You do a lot of testing with our patients in methylation pathways and things of that nature. One, is it effective? What can you find early on? And what do you see relative to response?
Well, I think one of it is,
let's see if we can wrap it up a little bit.
yeah, genetics could be something that causes maybe a problem. There might be something, but also there's a lot of things when you're looking at genetics. And look, to make it simple, let's say if I have milk and I add chocolate to it, what do I have? Chocolate milk, right? So, and not to say that's going to be a great thing to eat, but just for the example. But if I don't have any milk, what happens? So when we're testing things, we can actually find that, let's say, if you add the chocolate to it, then I get the next thing. So when you're looking at something, for example, if I'm making serotonin, I have to have tryptophan. You add an ingredient, and now it becomes 5-HTP. You add an ingredient, and now it becomes serotonin. You add some other ingredients, and actually can go into making things like melatonin. We need these things to go along. It could either be a thing that happens because of a genetic predisposition. I don't have that extra substance for some reason, or there's a deficiency. So we look at those, and we can test those in different areas to see what's missing. And if I add to that, can we have a change of response, or a kind of like some type of reaction response that we can test the body on and find out what's missing? And we can take a look at that. And so there's something called SNPs in the genetic world, which are actually, you're missing something. You're missing a sequence of amino acids that I just don't produce this very well. Now, if it's bad enough in the body, then sometimes the body never matures. That's why sometimes, we have miscarriages, things like that. We don't have a good genetic mix necessarily, but sometimes it might be just somewhat altered or something a little bit lacking. So we just need to find what the reasons are. Could be genetic. A lot of times it's terrain that we can see these things with.
It's very interesting when you see a patient come in and they have problems, and you can begin to shift and turn them around. There's one of the things I want to leave our listeners with is that the brain has a rhythm that if it's not interrupted, if it's not overridden by other things, it can repair itself if you combine it. We use the term stacking of therapies, right? Repair itself much faster. We use it with children and adults who are ADD and learning disabled and so forth. And what I'm talking about is the rhythm that can be reprogrammed by doing something very simple, listening to chamber music. Mm-hmm. Chamber music, Baroque music, basically, Baroque classical music has the same rhythm as a normalized rhythmic pattern of normal brain function. And all you have to do is you put it on in the background very, very lightly as you're doing your work, do repetitive patterns, get on and do your word games, things of that nature. And you'll find just by doing something like that, the brain will begin to normalize far better than it was before. So there's little things. We talked about MCTs, medium chain triglycerides, coconut oil. But to get an organic coconut oil and start consuming, 3, 4, 5, 6 tablespoons a day, spread it out through the day. It's not that bad. Don't cook with it. You can put it over. It's a kind of a gelatin in room temperature, but once you put it on something hot or in your mouth, it immediately liquefies, and it's not that bad tasting. But that also will help. What would you add to that, Scott, relative to things that they could take away and do?
Well, I think actually, we talked about exercise is one of those things. Do things that organize your brain, left and right side. You talk about frequency and what you were mentioning there too, light spectrums and colors. One of the things that happens, it's interesting when I have somebody comes in with, let's say, a concussion, and concussions have some interesting elements. There's an interesting test I do. I have the person read backwards, and then you can start hearing some changes in their voice, because when they have a concussion, they go to primitive brain. There's a higher order brain function, and sometimes they can't tap into it because of an injury. And so what you do is you do like a blue color glasses, actually calms the body down. And then they can actually start reading. You can actually notice the reading change as soon as they start reading backwards. And it's like a way to kind of find concussions, but it's also a way to treat using the blue glasses. So that's a frequency, like you're talking about, stacking. There's certain vibrations or certain music. They have people that doing like with stroke victims, and they're trying to do workouts, classical music playing in the background, and they can focus better and do their workout better when that's going on. So this rhythm that we need to have is very interesting. It's like an orchestra that you've got everything working, the horn section and the drumming section and all these things are working together. It's a beautiful thing. It works together. But like things like cancer comes up and knocks out the horn section, and now does it get back with the rhythm, or does it corrupt all the music? It's a very interesting aspect. I think I want the lowest probably common denominator in our human body is what gives off is frequency. If that's good, it's going to affect everything above it. It's an interesting science that's expanding as we talk.
Yeah, it's the things that are coming out and finally really understanding how the brain works from cranial injury, if you will. We haven't even touched upon the 22 bones that make up the head and how they breathe in and out. And if they're locked, if they're jammed, they cause a hydraulic pressure in it. And that not only could lead to headaches and things of that nature and spinal deviations, but it also can lead to cognitive dysfunction. And we've seen that over and over again. And the one thing that I've become very acutely aware of, because of some of the research and work that I've been doing, is that since COVID, they've really come around, and we've known it for quite some time, that the brain is affected by viral components. And it's important that people understand that those viral patterns that are out there, everything from the COVID virus, the flu virus, Epstein virus, virus, all of them will cross the blood-brain barrier. And they get in and they have havoc on that neurological transmission. But fortunately, what we're finding, and some of the work I'm doing with something called Oleander from a company called Phoenix Biotechnology, works amazingly well if the patient checks that is a viral pattern, to begin to reverse that and change things.
Yeah, absolutely. I mean, there's a lot of different things, and even so, they're talking about parasitic aspects we're talking about, and parasitics and viruses that seem to be like COVID seems to enhance other problems. And you want to make sure is there parasites involved? Is there things in regards to heavy metals? There's things that welcome some of these things to stay in your body. So cleansing the body, pulling that stuff out, getting that to make it work better, less inflammation. Inflammation's a blocker. You want things to flow and move. And that's the whole thing. The brain needs circulation. It needs oxygen. It needs stimulation. And it's interesting as we look at things. I remember going when my brother first had his stroke, and I went down there, and I went to ground rounds, the grand rounds for the doctors there. And I asked the doctor before we ended anything, says, is that what we're looking at? With this, he had lost pretty much the left side of his brain. Are we looking at trying to clean this up? We're trying to get stimulation. We got oxygen in the tissues. Do you want to do that? And he said, and everybody agreed with me. But the interesting thing, we kind of lose sight of some of the best things we've had, like acupuncture or maybe laser. And when I mentioned that up, the neurosurgeon steps out and goes, no, Dr. Lamp, we don't have any major large studies to go up there. And I'm like, but 5,000 years of empirical data.
That's right. Absolutely right.
What does that mean? And we're so arrogant that we're looking at something overseas and you say, well, it doesn't follow our criteria if we do stuff. I mean, that's BS.
Well, that's the biggest problem that we see today is that, from a clinical application, we see things that work amazingly well, and the medical community will say it's anecdotal. But anecdotal, when a patient totally reverses the process and ends up in a better place than what they were before, I don't know about you, but if it doesn't hurt anything, if it doesn't make things deviate in a different pattern that now we're substituting conditions. I don't know, but I'm all in. Dr. Scott, I'm looking forward to doing the program with you on December 17th. And those of our listeners that are in the Washington metropolitan area are going to be in the Washington metropolitan area, please join us. I promise you, it's going to be like drinking from a fire hose, but we're going to give you tons of data to take home with you. This is going to be an amazing process that you may not even thought about before. It's always a pleasure, Scott. I can't thank you enough for taking the time today and joining me on the program on Dr. Tom Roselle Ageless Health platform. We do this ongoing. We're going to have you back. I really appreciate it. And I'm humbled more often than not in your presence because you know stuff and I look at you and say, oh my God, really? Anyway, thank you, my friend. We're going to wrap it up. We're coming up to that part of the program where we have to say, we're going to be done in just a few moments. It's been, as always, a pleasure bringing you more updated information. We're going to continue to have people on who are really above the cut, who really know what the subject inside out and backwards. Having said that, don't forget, if you're in the Washington metropolitan area, December the 17th, and please be our guest. All you have to do is go to drtomroselle.com and register for the class. We'll see you next week, same old time, 8 o'clock on Eastern Board, and some of you are listening to 7 o'clock in the morning. Happy to do this for you. Happy to give you the information, and for one reason only. We love you all. Have a great day. Bye now.